Ebola keeps coming back to Africa? Well, my friends, welcome back to the AdieTalk show, where we give you a voice and celebrate your impact. Now, every few years, the same frightening headline returns. Ebola outbreak reported, and right now, Africa is facing that reality again and again. The Democratic Republic of Congo is battling a fresh Ebola outbreak, putting health authorities on alert and raising concerns across the region. But this raises a bigger question among us. We should ask that question. If scientists understand Ebola, if countries have fought it before, and if vaccines now exist, why does Ebola keep coming back? That's a very vital question to ask. Now, let's understand that the virus never really disappears. One reason Ebola keeps returning is that the virus never truly goes away. Scientists believe it naturally exists in certain wild animals, particularly fruit bats. And from time to time, the virus can spread from animals to humans through contact with infected wildlife. And this means that even after an outbreak ends, the source of the virus can still remain in nature. So while an outbreak can be stopped, the conditions that created it may still exist within us. Now, another problem is that Ebola often starts in remote communities. And at first, the symptoms can look like many other illnesses. For example, fever, headaches, weaknesses, and so on. But many people may not immediately realize they are dealing with Ebola. And that is the most dangerous part of it. And by the time the disease is identified, infected individuals may have already come into close contact with family members, neighbors, healthcare providers, and travelers all over the world, which is very, very terrible things that can happen among humans. That delay can make stopping an outbreak much, much difficult. Let's look at why containment is so hard. But Ebola is not just a medical problem. It is also a human one. During the current outbreak in Congo, there have been reports of tensions involving families who wanted access to the bodies of loved ones who died from suspected Ebola. Now, you see, this shows the difficult task that health officials are facing. And across many African cultures, burial rituals are deeply important. And families want to wash their body, dress the body, and say goodbye properly to their loved ones. But people need to understand that Ebola can remain highly infectious even after death. This creates a painful conflict between protecting public health and respecting cultural traditions. All this makes containing the outbreak even harder. Now, my friends, let's look at the bigger lesson. Africa is more connected than ever before. People travel across towns, cities, and borders every day for work, trade, and family. Now, the problem is that disease travels too. An infected person can move between communities before symptoms become severe and allowing outbreaks to spread quickly if they are not detected early. That is why Ebola keeps coming back. The virus still exists in nature, and some health systems still face challenges. The current outbreak in Congo is a reminder that fighting Ebola is not only about medicine. It is also about awareness, preparation, and public trust. So perhaps the real question here is not why is Ebola coming back, but rather, are we doing enough to stop the next outbreak before it starts? So my friends, what do you think? Should Africa countries invest more in disease prevention and public health awareness and public health systems? Please share your thoughts in the comments, like, share, and subscribe to the AdieTalk channel. Because here, we don't just talk, we ask the difficult and hard questions people are afraid to ask. Thanks for watching. Stay tuned.